You have completed your transition to the WAS. You are the WAS. This is totally going in the training video. This is Jonathan Fite, co-founder and chief executive of Beyond Lucid Technologies. And also on this training video is Chris Witt, president and chief technology officer of Beyond Lucid Technologies. We're going to take all interested parties through a quick training on the use of the MEDIVIEW platform and affiliated plugins to do COVID-19 vaccination tracking, appointment scheduling, and notifications, as well as the ability to aggregate data over time to be pulled into MEDIVIEW or your favorite ePCR system later for follow-up, whether by 911 or in a longitudinal care environment such as community paramedicine or mobile integrated health. So we're going to share the screen now, and you will be seeing what agency administrators utilizing our systems to document care will be seeing. We're also going to take you through the patient-facing view of the documentation process. With any questions or concerns, or to sign your agency up to use MEDIVIEW and these plugins for COVID-19 vaccine tracking, scheduling, notifications, and data aggregation, please contact us. Website is beyondlucid.com. Thanks. What you're seeing on screen here is the trio of forms that agencies signed up to use our suite of solutions. We'll see. Right, the first of these, the pre-vaccination form, this is for the public to use. The settings form determines basically the configuration of the public-facing form, and the administration form is where the data aggregation, review, and analysis takes place. I'm going to be handing off to Chris now. He's going to walk us through the process from registration of patients prior to receiving the vaccination. Then we're going to switch into the administration component where the agency can review data that has been aggregated and then prepare that for either import into a patient documentation system or upload into another system, such as an immunization registry or other aggregate repository. Chris, all you.
Thanks. So let's start with the pre-vaccination form and take a look to see what it is that people that are registering for their vaccine actually will be seeing. And then you can open it up right there. Down at the share link, you see a yellow, orangish arrow to the right. Click that, and it'll open up what it looks like. So here we have the pre-vaccination form. At the very top where it says baseline, that will be your agency's name. There are tweaks that can be made to this, and if there are tweaks that you need or additional data points that need to be added, we can work with you on that, as well as some of the default data elements that you can set. For example, this has Texas, it can be your state. On here, we have all the various required elements. So if you have certain ones that are required or not required, we can modify those for you and with you.
FYI, the questions on this form are actually based on the CDC enrollment document. So the CDC enrollment document incorporates all of these questions. We essentially built a digital version of that form.
This is a Texas example that has a immunization registry consent form. It can be in here for your state, whatever it may be, along with any required values. Now at the bottom, we have times that can be chosen for a vaccination for a particular patient. We have the ability to allow for vaccination appointments in the morning, in the afternoon, or both. So for this one, we can choose one of the two, morning or afternoon. And then from there, it will tell you the time slots that are available. If a time slot is not available, it will let them know. You can set the number of time slots for any particular period, the number of vaccines that are available in your settings form. So this is something that you can control and change on a day-to-day basis for your time slots. The morning versus afternoon time slots do have an hour break in between to allow for catching up or lunch or whatever you may have. When the requested time slot is chosen, when the person clicks on register, it will tell them if there's any outstanding required items. It will highlight those and require them to fill those in. So there's a few other required elements of that identify why you are receiving the vaccine. Near the bottom, if we can fill that out, we should be able to submit. If a person has included their email address, they will also receive an email follow-up with this exact same text to let them know about their appointment time, their confirmation token, and also a reminder to bring identification. We'll get into how to redeem this token and look it up and use it for confirmation for their actual appointment in just a few minutes.
Furthermore, if your agency is automatically signing patients up for their second vaccine, we can also provide a notification to them, a reminder of when their next appointment is going to be.
So now on the vaccination administration form, you'll go ahead and log in, put in your login name, whatever you're using to identify yourself, as well as the agency password for doing the providing the vaccinations. Now, this is where you're going to take the vaccination token as well as the identification for that particular patient and going to find them in the list. It is currently sorted by last name to make it easier to find the people, and then you can verify the token is what they were provided when they signed up. But we'll go ahead and select that, and you'll see that it pulls in all of the information that was entered in that first form. You can go ahead and confirm the identity number with the proof of identity that was provided. One thing to note, at least for now, you do have to reselect the race if you care about that. And then you can go down and you can look at the pre-vaccination checklist once you've verified that all the information is correct. If there is a yes that was been selected for any one of these, you'll be able to go ahead and select additional details about what that is from a clinical level. This will allow us to bring this data into an actual chart at a later time.
If your agency is interested in going beyond the capture of information for vaccination, administration, appointment scheduling, and notifications, and does have an interest in importing this information to your documentation system, whether an EPCR, a public health syndromic surveillance tool, or a longitudinal charting system for community paramedicine, mobile integrated health, or some similar program, do let us know. We can export these data into a variety of formats to facilitate that sort of follow-up. That is, of course, one of Beyond Lucid Technology specialties, but we also can provide this information for use in other charting systems for related functions.
Great, thanks, Sean. So once you've gone through and you've reviewed this entire checklist, you'll have a place where it has the name of the reviewer, which is based on who signed in for this particular form, and today's date for the date reviewed. It also has the current dose information that you're providing to this particular patient, and the majority of the data elements on this can be set as default elements in the settings form, which we will get to in just a little bit. That will allow you to not have to repeatedly enter in this information for every single patient. And as we go down, you'll see that it also brought in the choices that were selected for first responder relationship, as well as their qualifications for being able to receive the vaccine if they had any. We'll go ahead and click on submit to go ahead and record this particular vaccination. And once that's done, there we go. So once we've gone ahead and clicked submit, it is now recorded in the entries for this particular form. Now, let's go ahead and look a little bit behind the scenes to see how you're going to actually use this data. We'll first start with the pre-registration so you can see what is the data that is being captured when you send this link out to people in your population. Now that we've seen the front end of entering the forms, capturing the data, let's take a little look behind the scenes to understand how you can actually use this data. As the administrator of this particular tool, you will receive this in a Excel-like format, which is basically a table or a grid that has every single data element from that form. You're able to look through vertically or horizontally, depending on the number of forms that were entered, and see the data elements that have been aggregated together. This helps if you need to look at the tokens, if you need to look at a phone number, if you need to look at the ID, if you need to look at the email address. All of this data is in here and is provided kind of for an at-a-glance type functionality. The other thing that you do have access to in this particular view is if you click on a particular item in the list, a particular entry, you can then go in and actually edit it in the lower right-hand side, and then you can update it to whatever data values you need to. So if you need to change something, you need to change the status, you can do it for an individual record. If you need to change the status of many records, you can select all of them, and then in the upper part, you have actions, and you can set the status to completed. If you set something in this list to completed, it will no longer show up in the token list on the administration form. So that is one of the ways that you're able to hide the forms that have already been, the tokens that have already been claimed. You can also do it on an individual basis that we can set up once it's been used, but this makes it so it's not able to be claimed twice on 2 different occasions. To switch between the forms, you click on the name of this particular form in the upper left, and then you can either go to the settings form or the vaccination administration form. So let's go look at the vaccination administration form. And as you'll see, the data for this is what was copied over from the pre-vaccination form, with the additional elements of who reviewed this particular form, as well as the data about the vaccination itself. And so you're able to capture from this, as well as export the data for who received what vaccination, their personal identifiable information and demographic information, along with which dose, what's the manufacturing or the administration date of the vaccine, which vaccine was it, which lot number it was as well. So all of this data that you receive in here can actually be exported to Excel for you to use for anything else that it may be needed for. You select the items that you want to have in an Excel format, and you can click on the actions at the top and then export. And you can do the selection, or if you need everything, you can do all fields. And that's how you're able to work on this data offline. Also, if you want to have a PDF printout of a particular form, as you see on the right-hand side, you can print or create a document here in a PDF format.
Chris, why don't you take us through some of the settings associated with essentially the administration of the administration process. Tell us how you can customize the vaccination appointment setting and scheduling process for your particular agency. So walk us through the back end.
Sounds good. So let's go ahead and click on the entry in here for the settings form, and then click on the lower right-hand corner. It says edit, and that will allow you to change what are these settings for the forms. It's broken out into 2 sections. The top is the pre-vaccination registration section. It will control like the quantity of forms that can be filled out in total. Total number of signups per time slot. So if you have from 8 to 8:30, you have 20 people, 8:30 to 9, you have 20 people. That particular number, right now, it is a set number for all of the time slots, but also between morning time slots and the afternoon time slots, there is a 1-hour buffer to allow you to catch up if you need to. Also on here, we have minimum age. Some of the vaccines Moderna, for example, has a 18 as a minimum age, and Pfizer and any other ones will sometimes have minimum ages for the vaccine. So you can set that on here. It will do an auto calculation based on the date of birth to see if they qualify for the vaccine during their pre-registration and filling out that form. Vaccine administration date is also on there. So you can say this is for next Thursday, that these time slots are being created. Now let's look a little bit on the vaccine administration tracking. You have a common password that you can use for all of the people that are administering the vaccine. This is something that if you want to, you can change for every day that you're going to be doing the vaccine and administering those doses, but that's kind of up to you. After that, you have all of the default values that you want to use in the form itself. So you can say for this particular date, this is the date, this is the manufacturer of the vaccine, here's the lot number, here's the manufacturing date of the vaccine. So that can all be filled in for you, so you don't have to worry about that. And it will speed up the administration and all of the paperwork for the vaccine itself.
As Chris mentioned, there is a common password used by agency to access these forms. Please be sure to maintain the appropriate level of HIPAA compliance. The only people who should be accessing this form are individuals within your service who have undergone the appropriate HIPAA training as required. You should consider that all of the information documented in these forms constitute PHI. Do not share the password. We might recommend, especially if you have groups of providers assisting with the administration side of this process, that you change the form on a daily basis and essentially have that morning's code to ensure that that you're keeping secure everything that needs to stay that way. Thank you very much for your interest in the use of MEDIVIEW to assist with your vaccination processes. Stay safe out there, and thank you for all that you do.